All right, folks, since we're recording this, I'm going to go ahead and get started. Let's go ahead and kick this off. So I want to thank everybody for joining us today. We're going to be talking about balancing AI innovation with HIPAA compliance. We have one of our favorite guests here, Mr. Dr. Rob Chubbuck, Esquire, who's our CISSP friend. Real quick, few housekeeping items here. We do want to thank you, everybody, for attending. We are recording, so we will be sending this to everybody, and we record all of our webinars. If you have any questions, please make sure that you enter those into the chat. Jillian here will be facilitating those, and we'll try to get to as many as possible. This is a pretty heavy topic, so we expect that there's going to be a lot of questions, and anything that you need clarity on, just please feel free to put those in the chat for us, and we'll do our best to try to break things down. Just our typical disclaimer, things are changing very quickly. This does not constitute legal or tax advice. So if you have any specific questions, either reach out to us here at Total HIPAA or reach out to your legal and or your IT professionals as we go through this. There we go. That's my disclaimer. Sorry, I should have switched to the slides sooner. Here I am. I'm Jason Karn. I'm the Chief Compliance Officer here at Total HIPAA. For those of you who are clients, you're very familiar with me. If not, this is who I am here. And as we were saying, this is our friend Rob Chubbuck. He is our CISSP expert, and he's got more certifications than any other person I know. So he is our IT and NIST and HIPAA expert, and also a dear friend. So we're always happy to have him come and join us.
Jason.
So today we're going to talk about current state of AI in organizations, where AI and HIPAA collide, securing an AI pipeline, and then frameworks for compliant innovation. And with enough, hopefully we're going to have about 10 to 15 minutes left for questions and answers. But as Rob and I were talking earlier, we both like to talk, so we will try to move this along and keep this as informative as possible. So let's get started here without further ado. So how organizations are using AI today. So Rob, I think this would be a great place to start off with some of the ways that organizations are using AI. So maybe if you want to kick off with this.
Yeah, absolutely. I mean, a couple of things just to level set a couple of things. Everybody hears AI. I mean, we talk about AI all the time, and artificial intelligence. That's really not what AI is. I mean, yes, I know that that's what AI stands for, but it really isn't. What AI allows us to do from a real high level is it allows us to take and consume information very quickly, and we can arrive at various decisions, make various determinations based off of that speed that we're able to gather, because we're gathering so much information so quickly. And there's many different types of AI, and you've got a couple of them or three of them here on the screen. But I've got predictive AI. Okay, what is predictive AI? It's something that we can utilize to flag things based off of interpretation. We can predict whether or not we're going to have a threat based off of the utilization of the data that we receive. We've got generative AI, which will help write in our case, write incident reports, write something based off of the interpretation of the data, or generate something as part of that. We've got predictive analytics or prescriptive AI, which helps to determine how we can address something that's happening and make some kind of proactive response. And then we've got, operational and even anonymous or autonomous AI, which we can actually operationalize and have it automatically take actions for us. So there's a lot of different things that we can do with AI. It really is just about automating what we used to do manually.
Yeah. So can you give, I think maybe it would be helpful to give some examples of, like, with generative AI, we're looking at your chat GPTs, your Claude, your Geminis, like very high level, very consumer friendly versions versus, once you get into some of your, maybe, into, let's say, your CRM or other items that are looking for more predictive analytics,
Sure.
and maybe more operational items. So I think that's important also, is like where you're seeing AI and an integrate, like where you're integrating into your workflow or user flow versus things that are happening in the back end that maybe you're not directly interacting with, but is working behind the scenes for you.
Sure. Yeah, absolutely. And we're using this, quite a bit in the cybersecurity sphere, where we're taking and looking at, all of the different data inputs that we have, our log
Mhm.
files, our firewall rules, our firewall logs, the kinds of network traffic that may be coming into our organization, the types of reporting and generating of user information. We look at all of those data elements and those data points, and then we automatically, through our CRMs, through our vulnerability analysis tools, things like that, we're making those kinds of decisions automatically to determine what we need to do. So if we need, maybe we've got a threat coming in, from overseas, somebody is coming into one of our data centers, we're going and we're blocking that traffic based on the determination of, we're seeing a lot of traffic coming from one particular location doing something that we don't want them to do. And for
Mhm.
everybody here, the same kinds of AI can be utilized in your organization as well. I mean, it's not just because
Mhm.
I'm talking about the cybersecurity element. You look at that same kind of thing from your data protection. If you configure a tool to automatically start blocking transactions, based off of whatever rule sets you determine, that would be the where you could actually use AI to help address some of those threats.
Great. Awesome. So moving forward here, I think it might be helpful to talk a little bit, if you don't mind, about data and HIPAA compliance through an AI lens. Thinking about the privacy and the security rule and how that intersects with things people need to think about from the compliance standpoint.
Yeah, absolutely. You think about the privacy rule and what it's concerned with. It's concerned with how protected health information is used and disclosed. Okay. And so,
Mhm.
when we introduce AI, we have to ask, how is that data going to be ingested into the various models like the chat GPTs? I mean, we wouldn't want somebody taking my personal health record and just sticking it out there in a publicly
Mhm.
accessible chat GPT instance. And so we have to be very careful of that, making sure that when we are using AI, that we're not putting it out there. And then the security rule is going to focus on safeguarding the systems that store and process that data, making sure that we're locking it
Mhm.
down, that we're using encryption, that we're protecting it, especially because many of these tools, and even if we've got our own tool, they're going to be in the cloud. And because they're in the cloud, or because they've got some kind of open architecture, we need to make sure that those tools are protected to protect the data, making sure that we're not exposing somebody's information that should not be exposed. And so, what changes with AI is truly, it's the scale and the speed at which that the data can be processed. That you know
Mhm.
everything that's being done with AI today, we could do manually. It's going to take
Right.
us a lot more time.
Yeah. Yeah, it's fascinating that, like, the amount of data that our systems are processing and how quickly that's, and the innovation that we're going to see with that, with it being drug studies or cost savings along the way, as we're putting in all this data. But I think when we're going to talk a lot about that, about, what, you some real issues that come up with HIPAA compliance because of that, because of the requirements in the law versus what AI needs in order to be effective. So, yeah, I think that's really great. All right. So, in fact, that's the next slide, is, the core conflict. we've got aggregation versus minimum necessary, and here is a real clash here between what AI needs and what HIPAA requires. Maybe you want to talk more about this.
Yeah, so really at the heart of this issue is it's a fundamental conflict. AI systems will
Mhm,
perform much better the more data they have.
mhm,
Uh, for instance, if you put one little document into ChatGPT to start gathering information about a certain topic, you're going to get a limited amount of response material
mhm,
if as long as you're keeping it within in those bounds. But as you put more data in, or look at something like maybe even a Google with a notebook LM, put more documents in there,
mhm.
you're going to get a much better kind of response. And so, you know, because these systems perform much better, the more data they have, they're designed to learn really from that large data set, which will improve the accuracy over time. So from a healthcare perspective, the more data that we
Mm.
put in, the better it is. However,
Right.
that's at odds with our privacy aspect on the other side. And
Mhm.
so HIPAA requires organizations to use only the minimum necessary amount of data for that given purpose. And so that creates
Right.
that tension, if you will, between the innovation and the compliance aspect. And the
Mhm.
key is not choosing, one over the other, but it's kind of balancing and really protecting both sides at the same time. So that's going to
Right.
often involve, some certain techniques like using things like data masking or de-identification.
Mhm.
Your, of course, access controls. You're making sure that you are protecting that data so that it's not disclosed to outside entities, along with clearly defined use cases that justify exactly how that data is being used.
Right. Yeah. And I think it's really important to think about, are you requiring the individual to de-identify, or do you have a programmatic data governance de-identification that's happening? So, what requirements are you really having for the employee to then protect that information, saying, not using, or using generic referrals to clients or to patients or to folks that you would theoretically, you've got to be really careful about that data that you're putting within the system. So does require maybe some de-identification on the fly.
Absolutely, absolutely. You're going to see it in both regards, and
Hmm.
long term, organizations really have to think about how they architect their systems. And I mean, I know that for a lot of the people on this call, maybe they're using third party systems that are
Hmm.
developed, for their specific purposes. But developers are going to have to really think about how they are going to protect the data as data
Hmm.
gets ingested into different AI data elements and things like that.
Yeah, for sure. So one of the big things, and this is you know a really, I mean, this is a requirement here, is talking about the business associate agreement. But I think it's really important to have a discussion around, just signing the business associate agreement, which is a requirement, is, not necessarily enough. You really want to think about what data am I actually sending over there? What are these programs actually doing? And really reviewing, because we have this, this common agency provision as part of the omnibus ruling, is what are these common agencies? What are these groups doing with the data that we're sending over? Maybe we can talk a little bit about these business associate agreements and things to think about with when contracting with these third party groups.
Absolutely. Yeah, I mean, for one thing, for everybody out there, you cannot share this data publicly. I
Mhm.
mean, you just can't
Mhm.
take your data set and go, as we've kind of mentioned here, and I sorry to pick on ChatGPT, but it's just the one that rolls off my tongue really fast. But whether it's
Right.
ChatGPT, Gemini, whoever, you can't take your data and go stick it in there, even if you're trying to run a report. Um,
Mhm.
you know, you just can't do that. So many public tools don't provide the kind of contractual protections that you are required to have under HIPAA. and
Hmm.
specifically that goes right back to that BAA. And so if you don't have a vendor that has signed that BAA with you, you cannot legally share that information with them, period. I mean,
Hmm.
there's no there's no leeway in that. And
Right.
that's why organizations are moving towards, using much bigger enterprise grade solutions that providers are
Hmm.
willing to support, that are putting those certain controls in there, the encryption, those kinds of things on the backside to protect the entity, isolating your data within their data sets and
Hmm.
things like that. So the presence of that BAA itself also it's not just a legal formality. It defines the responsibilities that both parties have,
Hmm.
the accountability that both parties have, as well as exactly how that data is handled. And so, and
Right.
that is, your responsibility.
Hmm. Yeah, and I maybe you want to talk a little bit about not using the data, using the entity's data in training, because that is a key thing in these business associate agreements or in the contractual uh, moment with these groups, like your Geminis, your Chat GPTs. We'll throw Gemini under the bus for a little bit.
Yeah.
Your Anthropic is okay. Am I protecting this data? Is this data being used? How is this data being used, and what is this contract allowing these larger companies to do with it?
Well, and that's exactly it. Sometimes we don't even know how these companies are using it and training on it,
Hmm.
which is one of the big problems. And we've seen, many cases, not necessarily related to HIPAA and healthcare, but the training data that these companies have collected through vast training sets of materials. And there's been many lawsuits that have been brought up against many of these companies where they've taken
Hmm.
music libraries, or they've taken archives of books and other kinds of materials, as well as taking health information, and use that to help generate the data that they need. Because going back to what I said before, they need lots of data. The more data they have,
Right.
the better they can come up with determinations,
Mhm.
or identify solutions for whatever query is being prompted to that data,
Right.
or to that system.
Right. Yeah, for sure. All right. This is fascinating conversation. So let's talk a little bit about securing the AI pipeline. Let's talk about how, when going into these contracts, like how are we making sure that we are securing the data that comes in, or that we're sending out, I should say.
Yeah, absolutely. And securing AI is not just about securing the model.
Hmm.
Or even just securing the data. I mean, we have to secure the entire pipeline. And as you mentioned here on the slide, we got data at rest and we got data in transit with encryption, and we've got identity and access management. But it really goes even beyond all of that. We need to make sure that that data and that information is protected from end to end, whether it's in use, whether it is at rest, or it's in transit. So it really
Hmm.
hits all three of those different elements. And so when we look at how the data is stored, how it's transmitted, and who has access to it, encryption is really the foundational element, because it's the way that we can protect that information if somebody or something gets access to it that's not supposed to have access to it.
Right.
So,
Right.
but even that is only part of that picture. Identity and access management is critical. You need to control who can input the data into the AI
Mhm.
systems, and who can also view
Mhm.
it on the other side. Um,
Right.
and in many
Right.
cases, the output itself may contain, derived information, and that
Mhm.
can also become an issue as well. That interpretation of the data as it evolves.
Right.
Or
Right. Yeah, and that's an interesting problem that could come up is, can you re-identify somebody with enough, if you've put enough data within a system and you say, okay, we redacted things, we've done de-identification, but we're able to re-identify because we have enough aggregated data. Because again, we're back to that first statement, or the first part of, it requires a lot of data for AI models to be accurate. So,
Absolutely. If you've got enough data elements, you can identify just about anything. And we have
mhm,
taken, in a regulatory stance, and we've moved the needle quite a bit on what PII is, personally identifiable
mhm,
information. It
right.
used to be, I mean, most of people on the call here can probably agree. Social security number, sure, that
Mhm,
should be a one-to-one relationship. I can identify a person
right.
with that. Um,
Mhm,
but we've expanded what PII is, and PII can include things even like eye color. Well,
mhm,
there's probably many people on this call right now that have green eyes. However,
right.
if you take green eyes and then you start identifying maybe the person that's in Kansas right now, that that
Mhm,
set is going to be, that data set's going to be much smaller. Although I don't think you have green eyes, but
I
it's
know.
it's it, but that data set becomes a lot
Mhm,
smaller. But
yeah.
when we are looking at AI, it's got all those data
Mhm,
elements. So it's just a
right.
matter of figuring out which data elements can identify, that
Mhm,
person. And we're
right.
seeing that happen, far too frequently.
Yeah. Yeah. All right. So I think this brings up a really interesting, and maybe you can define what shadow AI is and how this is a threat to organizations.
Yeah, so one here again, I keep talking about what the biggest risks to organizations, but here again, here's another one of these biggest risks that organizations are going to face, and it's going to be this idea of shadow AI. It's not official; it's
Mm,
just something that's out there. Um, and if we start entering in data into these shadow instances, we lose
mhm,
control very quickly of that
mhm,
information, and employees, your staff is going to use AI, because it makes their job easier. Well, the problem is
mhm,
you just lost control. You need to make
right.
sure that your staff is following the rules, following whatever the laws are, the regulations are. And many times the employee is going to think, well, if I just put this in the chat bot, it's going to give me a reply and it's very quick and it's very easy. Well, that's
Mm,
great, but that becomes shadow AI. It's going to operate outside of the governance. It's going to operate outside
mhm,
of our security controls. It may even operate outside of our own awareness until something really bad happens. And then all of
right.
a sudden you get that visit, that phone call that you just
Mhm,
had a huge breach or a disclosure of your information. So we have to address that behavior, you know, early. And it's not
right.
about necessarily technical controls. It's
Mhm,
very difficult for you to prevent somebody from taking and doing a copy and paste into a tool that's out on the internet. I mean, we can do it. We can
right.
try to lock things down, and we lock things down all the time. But every
Mhm,
time we lock something down, there's three other things that are popping up. So
right.
it's kind of a cat and mouse game there. So education, policy, building that structure or of culture within the
Mhm,
organization to make sure that your people are practicing, security awareness, making sure that they're following the rules, making sure that you're educating them on a regular basis, annually or even
mhm,
more frequently than annually.
yeah.
Many organizations will do your monthly or quarterly phishing exercises in their email. Well, we're going to have to do the same kinds
Mhm,
of things with things like AI. You make sure that they're not
right.
doing some of these extra activities there. Uh, AI can be a great tool, and
Mhm,
I embrace the use of AI, but we have to make sure that whatever we're using uh, from a technology perspective, that we've locked it down, that we've got control over it, and we've got
mhm.
control over the data that's in it.
Yeah. So I think it might be helpful to go back and just define shadow AI as, AI that's not governed or authorized by the organization for use. So say you're using Gemini within, you have a business associate agreement and you've signed that with Google, and so you're authorizing your employees to use Gemini, and then somebody goes out and uses Chat GPT because they decide they like that better. Is how do you stop, and that becomes a real tricky thing because do you just deny access to that, or is that through policies and procedures? So it's making sure that people are using the authorized AI, not the what's out there, thus the shadow name. I think
That,
not.
that's
Yeah.
right. And we're also seeing, many tools that you've got access
Mhm.
to. I mean, if you got, Office 365, you may have Copilot built in and
Mhm.
things like that. So you've got to make sure that you're addressing that within your frameworks as well.
Right. That brings up a really interesting question here. Sorry to sort of put you on the spot with this one, but with a lot of these systems, they're now upgrading and they're going ahead and turning on AI. And you're looking at, Apple did this with their OS, most recent OS. You've got Apple now is reading your emails, reading your texts, reading data that's coming through, yet they won't sign a business associate agreement. So,
Right.
our general stance at this point, and the same thing with, Android, Google will sign a business associate agreement, but certain aspects of you got to be really careful as to what's covered. And so we are recommending here that people turn that off if they have protected health information coming into their email, into their texts, because you do not want Apple to have that information. Apple and Google want all the information they can get so they can, again, train their models. But you basically have a shadow AI use, but it's not something that somebody's doing maliciously, but something to think about. I don't know. How are you handling that in your situations?
Yeah, it's the same kind of thing. We're restricting access as much as we possibly can. We do that
Hmm.
through, technical controls as much as possible, but also through,
Hmm.
education and training. Ultimately, from a cybersecurity perspective, the weakest link out there are people, and
Hmm.
people are going to find ways, whether they do it intentionally or unintentionally, to circumvent systems. So although we lock
Right.
things down as much as we possibly can, um,
Hmm.
there's many times there's ways around it, or in the case of like Apple or many of these different vendors out there, they're going to turn something on that we didn't even know
Hmm.
about until all of a sudden we start seeing that we've got an issue.
Yeah. Yeah. I mean, and that really becomes an interesting and a real problematic thing for IT when dealing with bringing their devices into these environments. And so it's really a conversation and sometimes a difficult conversation, because you're going to want to at least get eyes on the devices and the security configurations to make sure that, yeah, they don't have Apple AI on, that they're not using these shadow AI, and not maliciously. It's just that's the default setting for the new Apple OS. That's a new default setting for Android. That's what you're going to be up against. Then you got to start thinking about, you know what other devices are going to have these AIs built in that are, if you potentially could be sharing information with. So
Well,
it gets to be a bit of a rabbit hole.
Well, it really is, and we're going to continue to see that be a bigger and bigger problem. I mean, we even see it now
Hmm.
with things like, if you've got a smart device, okay,
Hmm.
an Amazon Echo or an Alexa type of device or a Google
Hmm.
device, and you just happen to be on the telephone talking with one of your clients. Now
Hmm.
you just added
Yeah.
some data elements into that device, and how I can talk about something, and all of a sudden, every one of my web browsing requests and my
Hmm.
messages that I get on my phone, everything is going to all be surrounded based off of what I was doing. The same kind of thing
Hmm.
happens with AI. You go to do a couple of queries. Next thing you know, you're going to get marketed that way, and that's why these vendors are
Hmm.
collecting all this data.
Oh yeah, oh yeah. Well, I was dealing with plantar fasciitis, and it was amazing what all of a sudden showed up in my social media as far as ways to stretch, exercises. This person has the ultimate hack. This person knows what's going on. Everything else is bunk. This is the thing you need, and it was amazing. It was amazing. It was pretty scary, but it's amazing the amount of information that was marketed towards me. So. Um,
Absolutely.
yeah. I'm sure I'm not the only one who's faced that. So this, I think, brings up, and this is, where total HIPAA can really be a part of this conversation, and why we're having this conversation today is AI governance. How are we taking care of this? Who needs to be at the table? How do we have these conversations? I think that's a great place to kick off, is who needs to be at the table, Rob?
Everybody. It's, AI. I mean, honestly, it's
Yeah.
AI cannot be managed by just one department. It's
Hmm.
it's really it's a cross-functional operation at that point. You need representation, of course, from your IT security people. You're going to need
Hmm.
representation from your legal and compliance people. You're going to need representation, maybe from your clinical leadership, as well as whoever your stakeholders are, your executive sponsors, whoever can make
Hmm.
decisions. All of
Yeah.
these different areas need to be represented at the table to help guide the process. And part of that
Hmm.
is, some people will say, well, why do you need clinical people in this? Well, because they're going to be the beneficiaries of the use of this tool, and they're going to be the ones that are going to
Hmm.
probably push to use it. Meanwhile, you've got your IT or your cybersecurity people; they're going to be pushing against it. So, you
Right.
need to have that balance from a business process. Understand what the use cases are, and then look at how we can best protect the organization. And this group is going to be responsible for helping to set the policies, looking at those use cases and
Hmm.
ensuring that the AI initiatives align with the overall risk posture or the risk tolerance of the organization.
Hmm. Yeah, I think you bring up a really great point there about making sure that you have employees at the table talking about what their real life use is, because we can develop in a vacuum. We can, regulate in a vacuum and say we're going to never use this and we're never going to do this, and then all of a sudden it gets to the real world, and somebody who's actually using the systems sits down and says, hey, in a day-to-day action, I need access to these systems. I'm going to use this. This is part of my workflow, or this is going to make my life easier. And we used to call it, developing in a vacuum. I think regulating in a vacuum is the last thing you want to do, because then you're back to that shadow IT, shadow AI use, and you're having people who are gonna look for ways to circumvent, and you're better off to bring, folks into the conversation to make sure that you've got everything covered.
Absolutely. You definitely want to know what your people are doing. And so,
Hmm.
if they don't have representation at the table, they're going to find a way around it, and then you may not know what they're doing.
Right.
Um, and maybe they've got a really good use case.
Hmm.
Maybe you really do need a solution to be able to use that type
Right.
of process. And
Right.
so, and let's face it, the feedback that you get from your business people are going to be, that's going to be probably more valuable than the regulatory side.
Hmm.
Understanding what the process is, understanding what the workflow is, understanding where the problem areas are, and then we can
Hmm.
look at how we use technology to help benefit the organization.
Yeah. Yeah, for sure. For sure. So, um, this is, I think, an important piece here as we get into the regulatory item and having these conversations, is conducting an AI specific risk assessment. HIPAA requires that detailed risk assessment. And I think it's not much of a stretch to say we've got to map these systems. We've got to map the data flows. We've got to look and see what systems are being used, have a catalog of what's authorized, what's not authorized, where we have our business associate agreements. I don't know. What else would you add to this or discuss around this?
Well, I agree. Your traditional risk assessment really is not enough for AI, and there's two big directions that AI goes when we're using AI in general. Is number one, we want to be able to trust the data and trust the information that we're getting back out of it. So it's
Hmm.
got to be trained with models that are appropriate. It's got to be trained with accurate with an accuracy goal in mind. We also have to look at
Hmm.
how the interpretation of the request, whatever our prompting is, whatever our ask is, we want to make sure that we're not putting biases in and getting the answer that we want as opposed to getting the
Right.
answer that is accurate. So
Hmm.
when we're looking at risk and risk assessments, we really look at both the data element side, but also the processing or the output side. And that's going to be vital to make sure that your organization is really protected. And maybe one of the most critical questions ultimately comes down to whether your data is being used to train external models.
Hmm.
If that's the case, it's going to introduce significant risk to your organization. So, that is something that your AI specific risk assessment is going to really need to look at. Look at the workflow,
Hmm.
where are the possibilities that AI could be ingesting data, and then
Hmm.
identify that and then lock that down so that you don't have that as a risk.
Yeah. And I think also, and this is something we've discussed in the last probably year a lot, is just making sure you know where your logs are and what data is being logged and access and use cases are being logged. I mean, there's a whole list of items because you've got to be able to go back and figure out what happened, because a lot of times we don't know what's happening in real time. It's after the fact that we discover, hey, we had a problem here, and we have to go back and we have to figure out exactly what happened. That's where having good logs, knowing where things are, is really going to be key to being able to move forward and to figure out next steps.
Absolutely. And we talk about, you've got here the bullet point, mapping your data flows. I mean, understanding how
Hmm.
your data is getting processed is vital. We can't fly by the seat of our pants. I mean, we
Hmm.
need to understand exactly, how things are operating, how things are being generated, how the work is getting processed. And that's gonna help in a number of ways. Number one, it helps us identify places that we may have a gap. We may have a gap in our
Hmm.
security, but it also identifies places that we can improve.
It's funny you say that because it feels like we've been flying by the seat of our pants as AI has been launched onto us in this world. It's almost like
Yeah,
we woke up one day and it was like, hey, we got this great new tool. And now we're going, oh crap, how do we use this? How do we safely and effectively use this tool? And we're trying in real time to figure out how this is going to work within companies, within these organizations, and especially organizations with folks who are here who are working with PHI, with non-public personal information, and PII, the most inclusive of them, is how do we use these tools effectively and safely, and use them because they're great tools. I mean, we're not saying these tools aren't useful and aren't an important part of workflows, but it's just how do we protect ourselves in using these and make sure that we're using them properly.
well, think about it. AI, as we know it today, um, it's only been out for a couple of years, a few years.
Yeah.
It's brand new. And we're
Hmm.
still trying to figure out, the use cases, what's being done, how it's being done. Um, and that's going to continue.
Hmm.
It wasn't that long ago that we didn't all have a cell phone. And
Right.
now, everybody has a cell phone. Everybody
Hmm.
has basically what used to be a huge computer that they carry in their pocket. Um,
Yeah.
and now AI is that next iteration of technology.
Yeah. I mean, it's amazing. It's the little anecdote I like to use with that is that we have more power in our pockets now than we had on the Apollo moon landings.
Absolutely.
That, and that's just and we're still trying to figure these things out and still in real time because things are changing so quickly, and that's part of that first disclaimer slide too, is just you've got to ask the questions and you've got to reach out to your folks, because what we say today, and especially right now, what we're saying today could change within the next couple of hours or next couple of days. So it's just making sure we're keeping on top of what's happening and as best as we can, you know,
Absolutely.
um, which
Absolutely.
is where total HIPAA comes into play with a lot of these folks, is making sure because you've got you're an insurance agent, you're developing software, you're doing things, you're not a compliance expert, and nor should you be necessarily. That's where having a third party helps with those answering those questions and figuring out how to navigate this ever changing landscape. So this is, I think a really important part too here as we talk about acceptable use. We were talking about, not using shadow IT, your data flows, and I think this is the next thing is what do your policies and procedures look like? How do we train our staff, and how frequently do we train our staff? And it almost feels like we've got to push towards those quarterly, at a minimum quarterly meetings, just to sort of give updates and see what's going on and as things change.
Yeah, absolutely. And policies in general are vital for organizations, and they do have to be practical. I mean, we need to have
Mhm,
policies that can be followed.
mhm,
Some organizations, try to really come down really hard on their employees and box them into a corner. And policies are not meant to do that. Policies are
mhm,
meant to say what we can do and what we can't do. And
mhm,
you want to make sure that they're practical for the organization, make sure that that the organization can continue to operate properly.
mhm.
Putting a policy in place, and I can come up with all kinds of policies that can prevent you from doing anything bad, but you're never going to get your work done. You've got to have
Right.
policies that still support that business side of our operations. And your
Mhm,
employees need to understand that exactly what they can do and what they can't do, especially when it comes to AI. And that's going to include, the guidance on handling sensitive data, what systems they can and can't use, what kinds of use
mhm,
cases they can follow, and ultimately the equally important in this whole is the concept of the human oversight. We still need
mhm,
to look over what everybody's doing, making sure that everybody is continuing to follow the best guidance that's out there. AI should be
mhm.
used to support decision making, not replace it. Um,
Yep.
you know, and that's something that from the cybersecurity side we look at all the time. I mean, we can generate reports very, very quickly because we can use AI to help
Mhm.
gather that data, but we still have to go back
Right.
and we have to validate it. Don't
Yeah.
take AI as the end all be all. You want to make
Mhm,
sure that there is somebody still, kind of, minding the house, making sure that,
right.
that there's somebody looking at it to help reduce errors, reduce bias.
Mhm.
And bias is going to continue to be a bigger and bigger issue when it comes to AI. And you want to make sure that you don't have any unintended consequences either.
Yeah. It's interesting you bring that up. I've been playing around with the VS Code and using AI coding. And there are certain mistakes that the coding generator makes. And I wonder if it's just because it's seen that mistake enough times, but it thinks that it's actually correct. And the number of times I've had to go back and correct code that has come through, and you're like, this, why is it making this mistake? It seems like that it should be able to test itself and figure out that this is not a good solution to a problem. But I think that's really important to say, as a part of this policy is proofreading.
Yeah,
Review needs to be a key part of this, because yeah, this is aggregated information. This is the best analysis or best information that this model has. But back to what you originally said, it's not artificial intelligence. It's more of an aggregated of our knowledge, and it's taking the best average of what the knowledge is. So it can make mistakes too. It can hallucinate things. We've seen with Grok that it has been forced to make errors, that people have figured out how to hack those systems and make funny things come out of it, which is hilarious in a news report, but it's also kind of scary if you're using that as your system and it's making those mistakes. So who's reviewing
absolutely.
that data coming out?
Yeah, and AI will make up its own stories. It'll make the
Mhm.
stories to kind of fit its needs. And one thing I
Right.
did probably about a year ago now is I went into ChatGPT, and my grandfather had a dairy in Arizona back in the 1950s, and I
Mhm.
in a small town in kind of the western northwestern side of Arizona, and I put in there and said, "Tell me about Chubbuck's dairy." And you know
Mhm.
what? ChatGPT told me about Chubbuck's dairy. It told me about this man and his wife, how they had a dairy and they had an ice cream bar and they did all this stuff. And I was like, I don't even know who these people are. It's a great story, but that's exactly what it was. It was a story.
Right.
And you have to be careful because AI may do just that. Now, currently, if I put the same question out there to ChatGPT, at least it tells me we can't find enough information about that. It tells me to go to the county seat and do that kind of thing to find out more about it. But it's those kinds of things that we have to be really careful of when we are leveraging AI, is because it can make up its own story, just like we see in the media and the news and all the AI that's being used out there. Whether that's pictures or whether it's just stories. It all sounds good, but the reality is there's a lot of misinformation that's generated as well. And so in our own organizations, we have to be careful that we don't start moving from center and start interpreting that data wrong or incorrectly.
Correct. Yeah. So we are going to be sending out a PDF of this AI vendor checklist. But I just wanted to throw this up here. And I think this is really important to have this conversation and make sure as part of your, before you sign these business associate agreements or before you start using this, is, make sure you're going through and you've gone through this checklist. Because this, again, back to that common agency provision, you are ultimately responsible for the programs and the vendors that you use. You don't have to follow them around and you don't have to manage their compliance, but you do need to make sure you've done some due diligence to figure out what they're using, how they're protecting information. So number one is, signing the business associate agreement. Key required. Do not pass go, do not collect $200 if they won't sign that business associate agreement. Does the contract guarantee your data won't train their models? That should be front and center. We don't want protected data. We don't want any client or any employee data being used in these models for training. We want our data to be isolated from the general larger model. Role-based control, immutable logs of who accessed what. We got to make sure that we have good logging and we know who has access to that. And then for a lot of these folks, they are using third parties. So do they have business associated subcontractor agreements or business associate agreements with the providers that they're using? So these are all good questions that you need to make sure you're asking of the vendors that you're using. Because it's usually not cost effective to develop your own LLM, your own large language model, since there's so many great ones out there. So there's a lot of subcontracting going on. So some things to think about here, and we'll be sending out, as I said, that checklist. But we are at the wonderful time. We got about 11 minutes left here. Jillian, do we have some questions here from our esteemed audience here?
So far, no one has asked a question, but I have some of my own. And if anyone has a question, please send them in.
Great.
Could one or both of you explain the difference between an out-of-the-box AI model, what you or I might just see when we go to chatgpt.com or Gemini or whatever, and creating my own model when I do those, and I upload all my own, don't use any of my information for the larger model itself? What's the difference? What's the difference in capability?
Yeah, sure. So if you're using a publicly accessible model that's taking vast amounts of training data and leveraging all of that information and then inputting your information along with it, your information gets related with that model, and so it doesn't have that same kind of protection as you would if you were training your own model. If I built my own LLM, large language model, which is really what our AI that we utilize today is, and we keep our information contained that way, we can protect it. But many organizations aren't in a position to be able to set up their own LLM to be able to do that. So if you're using a public system, it's going to be shared. If you're using a non-public system or a private, we'll call it a private system, you can look at just your data out there. And I do see a couple of other questions coming up there about the AI note takers that we see coming into all of our meetings. and what impact that has. Well, those, I mean, me personally, it kind of scares me,
Mhm.
because you never really know who is taking notes, and many times you'll see these meetings where you don't even know who the invitee is, or who's been invited to that
Right.
big Zoom meeting. Um, so there is a huge risk in those. I think organizations
Mhm.
do need to make some decisions as to whether or not they're going to allow them. And depending on the
Mhm.
types of meetings you have, you could be opening yourself up to some significant exposure there. Especially if you're in those meetings, there's discussions where you are introducing, we'll just say sensitive information, expanding just, even beyond just PII or PHI. But if you're expanding into some other, business sensitive areas, you don't know who's collecting that data and where it's going.
Right. Right. Yeah, and I think that really comes back to also, do you have agreements in place? Do you have, either contractual or business associate agreements if you are a business associate or covered entity that requires that? Um, you know, I like the note takers, but it's also scary. Yeah, I agree with you. It's very helpful to have those summaries. It's very helpful to know what's going on. I'll tell you from a total HIPAA standpoint, we have a contract with Google that our information and any information that's used that is collected is not used for training, and it says it on every screen that I log into, and was very careful about contracting and using it that way. There is a little bit of, depending on that they're going to follow the contract, and who knows in the grand scheme of things, but I assume that Google has every, like all companies, has every reason to follow the contract and not to break that. But I think in a lot of situations, if you're going to be discussing sensitive information and and these note takers are in there, I would say it's probably best for it to be your note taker, not somebody else's. And that might be an arm wrestling match. But I've been in a lot of meetings where folks have asked for the note takers to be taken off. And so maybe that's a great stance to start with, is just say, hey, we're going to be discussing items that I don't know what that note taker is, so I don't want it as a part of the meeting. And just ask politely for them to be kicked out. That it's sort of a general idea. I don't know. What are your thoughts there, Rob?
No, I agree. I don't necessarily like having note takers in there taking notes about what I've said or what I've done, or recording,
Hmm.
recording me without my knowledge, essentially.
Right.
Because you don't know how that information is going to be used, now or in the future.
Hmm.
If the organization wants to have summary results, or they want to have transcripts of a meeting that they distribute, I think that's fine for the organization to do that, because they're driving that, as opposed to having
Hmm.
some third party, especially these third parties. I go into Zoom meetings all the time, and you'll see all kinds of note takers, and
Hmm.
I've logged out of many meetings because I don't know who these people are, much less their note takers. And
Right.
many times people are sending their note takers to meetings that they don't want to go to. So,
Hmm.
I kind of move against that. I think that's not
Hmm.
good,
Yeah.
overall, but very beneficial. I mean, let's face it,
Hmm.
getting a bulleted checklist of what was discussed, who it was discussed by, who's responsible for what coming out of a meeting. It's great
Hmm.
information, but
Right.
it's not very comfortable either.
Yeah. I would say in situations, if it's a sales meeting or something that's very high level, you're probably fine to have those bots in there because you're not going to be discussing too much sensitive information. But if you're going to be having patient conversations, you're going to be having discussions that includes PHI, you're better off not have those note takers in there, or if at a minimum, make sure that it is yours, that you have a business associate agreement with, and that you are clear with the other folks that are in that meeting, that that we have a business associate agreement, and this is what, and just be clear and disclose what the use is of these versus just this is some fly-by-night chatbot that's come in to take notes for us. So
Yeah, absolutely.
all right.
And
Okay.
there's also a question about the thoughts on Microsoft Copilot in an enterprise setting. I think we touched on this a little bit earlier, where, many of these different companies are, adding AI and AI elements into their product suites. From the with Microsoft, I can tell you in the government setting, many parts of the federal government are allowing for Microsoft Copilot to be leveraged.
Okay.
Now, as far as the compliance side of things, it's a little. I'm a little nervous with what information is still getting collected, where it's getting collected,
Right.
how it's being utilized on the back end when it comes to sensitive information. I mean, for as much as I love technology, I love AI. I think there's a lot of opportunity there. At the same time, I'm a little nervous too.
Yeah. Yeah. I mean, I think, not to pick favorites in this, I think we can generalize this a little bit more and say, Copilot, Gemini, these larger models, these large providers that are providing us with these services is really just, you got to make sure that you've signed the business associate agreement, and you've got to make sure you've got you've got contracts in place that will protect the data, and that and see that your data is not used in a larger model. I think it's helpful to have those pieces, and I would definitely say, yeah, we need, if you're going to use them, I think they're great little pieces. Oh, wow. I keep getting noises in my headphones. I don't know if you're getting those. Is that it's probably telling us that it's time. Is that just make sure that you contractually, you have the business associate agreement. Make sure you've gone through and reviewed those using that checklist. I mean, the Copilot uses Chat GPTs in the back end, if I remember correctly. Gemini is their own proprietary, but again, they will sign those business associate agreements. So I think they're fine to use at this moment. I agree with you about some of the hesitancy and some of the, what are they actually doing with this data? But I also think people are going to use it regardless. So I think you've just got to make sure you actually, and you have those policies and procedures in place, and you've done your due diligence as best as you can.
Yeah, there's one other question here, and it's, if our organization already has a BAA with Microsoft or Google, does it automatically cover the use of Copilot or Gemini, or is it a separate BAA that's needed? I'm gonna let you take that.
Yeah, thanks. It should be covered, but that's an opportunity for you to then make sure that you have the enterprise version, that you have the high enough level of what's going on there. So, but yes, that's a great opportunity for you to review those and make sure that you've downloaded the most recent business associate agreement. We have updates that have happened in the HIPAA law in the last year. So this is a great opportunity to renew and review any business associate agreements to make sure that it's dealing with substance use disorder. You've got the SUD updates that just happened. We've got, AI, making sure that those programs are covered. So I know that the Google Business Associate Agreement lists out the programs that are covered and not covered. And so reviewing that and making sure you have the most recent updated version, that's going to be key to making sure that you're HIPAA compliant. So I wouldn't say that they automatically cover those. I think you need to go back and review and make sure that you have the most recent version of their business associate agreement and what is covered. So, all right. Well, everybody, thank you so much. If any other questions come up, you know where to reach us. You can always find us here at Total HIPAA. We can reach out at the info@totalhipaa.com for further questions. And then we also do, if you need any assistance with any HIPAA compliance, we do have the opportunity for you to schedule a brief meeting with our team here to discuss any items that may come up, or if you need help with HIPAA compliance in general. Rob, as always, it's a pleasure. Thank you so much for spending this hour with us. We really appreciate you and appreciate the time you spent with us. And thank you, everybody. Have a wonderful rest of your Wednesday, and hopefully we'll be talking to people soon. Thank you.
Thank you, everyone. Thank you, Jason.